Welcome to STEEP, the Staying Steady, Exercise and Education programme. This is the first of a short series of films designed to help you gain more knowledge, understanding and confidence to deal with falls and how to prevent them reoccurring. In this film we will talk about what a fall is, facts about them and the different risk factors of falling. We will also discuss the fear and anxiety some people associate with a past fall, and then show you some positive actions you can take to help prevent future falls. A fall can be defined as a trip or slip that results in a person unintentionally landing on a floor, the ground, or a lower level. Around 30% of adults who are over 65 and living at home will experience at least one fall a year. This rises to 50% of adults over 80 who are either at home or in residential care. Hip fracture is the most common serious injury related to falls in older people and accounts for £1.9 billion in hospital costs per year. Falls are estimated to cost the NHS more than £2.3 billion per year. In 2018, 255,000 emergency admissions to hospital were due to falls in patients over the age of 65 years. There are many reasons why you might have a fall, and you need to be aware of the risks in order to reduce them. For instance, your eyesight could be a big factor, your medication, or how mobile you are too. We break these factors down into two categories: intrinsic and extrinsic. Intrinsic factors relate to yourself as an individual, so one or a combination of medication, low blood pressure, general age-related changes, your medical condition, trouble with your eyesight, or reduced balance and muscle weakness. Extrinsic factors are to do with your environment, for example, trip hazards and clutter, steps and stairs, poor lighting, uneven or wet surfaces, your pets getting under your feet, or even your footwear. Take a moment to think about your own history of falls. How many of these risk factors sound familiar? Once you've had a fall, it's very easy and common to experience fear and anxiety of falling again. This stress can impact your day-to-day life and stop you enjoying it like you once did. Fear and anxiety creates a vicious circle where you lose confidence. You tend to stop socializing, which in turn leads to reduced activity levels and deconditioning. As a result, you can become unsteady on your feet, which leads to an increased risk of falling. But the good news is that there are ways to prevent further falls and regain your confidence. Positive steps you can take include removing clutter and unnecessary furniture to make getting around easier. Make sure you have good lighting to help your eyesight. Wear well-fitted shoes that have good support for your feet and do regular exercises or join a local class to increase your mobility, balance and strength. Also make sure your glasses are appropriate. We do not recommend varifocals. These can affect your depth perception and your eyes continue to have to adjust, making you more likely to fall. Fuel your body by eating well and drinking plenty of fluids. Don't rush. Take your time. Learn to take a moment, relax, and control any anxiety. And lastly, remember to use a walking aid if you need one. A walking stick or a wheeled walker can improve your balance and stability. Thank you for watching, and if you have any questions regarding this film, please speak to your programme representative or discuss your concerns with your GP.